Assalamualaikum and hello everyone. My name is Nabila binti Rashid and I'm from DPH cohort 48. We'll be discussing about peptic ulcer. So, what is actually peptic ulcer? So, it is a disease that caused by an open source, which is what we call ulcer, to develop lining of digestive tract. So, the word peptic itself is related to digestion. Pepsins, which is major digestive enzyme that produced by stomach, and stomach acid, is the key ingredient for stomach juice, which is responsible for breaking down food chemically for digestion, which is highly corrosive. And also, the stomach endoderm has a thick mucus to prevent any damage, which is provide protection. So, imagine the protection itself is being corrupted. What will happen? So, keep in mind, the stomach juice is highly corrosive. So, when the protection is being corrupted, the stomach juice will erode the lining, creating the ulcer. So, there's a different types of peptic ulcer. So the two common peptic ulcer is duodenal ulcer, which is account for almost 80% of peptic ulcers, and stomach, also we call gastric ulcer, account for almost 20% of peptic ulcer. That's all from me. Thank you very much.
What causes peptic ulcer? So the first one is H. pylori, damage the stomach lining, make it easy for acid to hurt. So the second one is NSAID medication, painkillers like aspirin and ibuprofen can weaken the stomach protection. So the third one is smoking and tobacco, increases ulcer rates and slow healing. So the fourth one is too much alcohol, harms the stomach lining, making acid, damage roots. So the last one is chronic illness, diseases like diabetes and kidney problem raise ulcer rates. Peptic ulcer occurs when the stomach or intestinal lining is damaged, leading to painful sore. Several factors contribute to their development. So the first one is genetic predisposition. Some people inherit a higher risk of ulcer, making them more vulnerable. So the second one is medical condition. Certain diseases like chronic gastritis weaken the stomach lining and increase the ulcer risk. So the third one is frequent steroid use. Long-term use of steroids can erode the protective lining, leading to ulcer. So the fourth one is dietary habit. Spicy habit, excessive alcohol and smoking can worsen symptoms and slow healing. To prevent ulcer, maintaining a balanced diet, managing stress and avoiding excessive use of steroid or irritant are essential.
Next, we will move on to diagnosis. Here's how the doctor will diagnose the patients. Doctor will ask about symptoms, family history and medical history. Next, the test during an endoscopy exam, which is detailed imaging test. For example, CT scan, that also known as computer tomography scan or GI series X-ray exam. It can detect larger ulcers. Test for H. pylori infection, including a urea breath test or a stool test. Here is example for non-invasive test. Firstly is stool test. Doctors will give a container for catching and holding stool sample. Secondly, urea breath test. Swallow a capsule, liquid or pudding that contains urea level. Lastly, the blood test. Doctors may use blood tests to check for signs of H. pylori infection or complication of peptic ulcer. The last one of my slide is example for invasive test. Is rapid urea test. Biopsy sample taken during endoscopy for urea activity. Next, histology. Biopsy samples are examined under microscope. Next, the culture that grown in lab helping an antibiotic resistance testing. The last one is polymerase chain reaction, genetic testing on biopsy samples.
My name is Regina binti Soimi. I'm from DPH 48. Today I will present about treatment for peptic ulcer. I will explain about natural treatment for peptic ulcer. First, eat an anti-inflammatory diet. Certain food help reduce inflammation and support gut health. Include fish, chia seeds, and avocado for better digestion and nutrient absorption. Second, consume probiotic. Probiotics restore balance to the gut microbiome, improving digestion and nutrient absorption. They are found in yogurt, kefir, and fermented foods, helping maintain a healthy gut environment. Third, drink cabbage juice. Cabbage juice is rich in vitamin C and has been studied for its potential benefit in healing ulcer. Drinking it regularly may help reduce irritation and support digestive function. So, next we will discuss medication treatment commonly used to support digestive health. First, proton pump inhibitors. PPIs reduce stomach acid production and are used to treat conditions like GERD and ulcer. Example medication is omeprazole, lansoprazole, and esomeprazole. 2. Antacid. This medication quickly neutralizes stomach acid, providing fast relief from heartburn and acid reflux. For example, medication is sucralfate and bismuth succinylate. Third, prokinetic. Prokinetic drugs improve gastric motility, helping food move more efficiently throughout the digestive tract. For example, medication is aluminum hydroxide, magnesium hydroxide. Thank you, that's all from me.